everyone, I am Michelle and Kawade, grade 12 Espina. So, what are the risk factors in dance? Risk factors for dance injury include previous history of injury, insufficient skills in copying with stress, low body mass index (BMI), and fat levels, risky movements and techniques, and overtraining. Ankle sprain can happen to anyone whether you slip or step off a curb while walking or running, roll your ankle playing soccer, or land badly after a layup with your friends. There are 3 levels of sprains, and each can happen to the ligaments on the inside or outside of your ankle. Achilles tendonitis. Pain at the back of the ankles or lower calf may signal a problem with an Achilles tendon. Athletes who participate in track and field, soccer, volleyball, softball, and racket sports, such as tennis, are particularly susceptible. Tendons are taut bands of tissue that connects muscles to bones. The Achilles tendons connect the calves, gastrocnemius, and soleus muscles to the calcaneus or heel bone, one of the longest tendons in the body. The Achilles tendons is essential for walking and running, making it susceptible to significant wear and tear. Trigger toe is sometimes referred to as dancer's tendonitis, reflecting a patient population that is often afflicted by this ailment. However, while FHL tendonitis has historically been described within the context of dancers, especially classical ballet dancers, symptoms have also been reported in others. Ankle impingement. A common source of chronic ankle pain among athletes is anterior ankle impingement. This condition, sometimes called footballer's ankle, causes pain in the front of the ankle joint. It's caused by build-up of scar tissue or bone spurs, using in response to an acute injury or chronic stress on the ankle. Snapping hip is when you hear or feel a snapping sensation in your hip when walking, running, sitting, or getting up from a chair. This snapping sensation can be on the front side or back of the hip. Adolescent's anterior knee pain. The knee is considered as one of the strongest joints in the human body, as it is a complex network of muscles, tendons, and ligaments connecting the thigh bones, the upper portion of shin bones, and the kneecap. Despite its strength and durability, this complex network can become inflamed and leads to pain in front and center of the knee, typically beneath the kneecap. Commonly experienced by teenage athletes, this condition is known as adolescent anterior knee pain. Hyperextension means that there been excessive movement of the joint in one direction. Straightening, in other words, the joint has been forced to move beyond its normal range of motion. When this happens, these tissues around the joint can become damaged. Patellar malignance occurs when the patella moves out of the patellofemoral groove, called as trochlea, and the bony head of the femur. If the kneecap partially comes out of the groove, it is called as ablation. And if the kneecap completely comes out, it is called as dislocation. Meniscus tears are among the most common knee injuries. Athletes, particularly those who play contact sports, are at risk for meniscus tears. However, anyone at any age can tear the meniscus. When people talk about torn cartilage in the knee, they are usually referring to a torn meniscus. Osteoarthritis is the most common arthropathy and is a leading cause of pain and disability in the Western world. Toe touch to reduce your belly fat, enhancing your overall strength and flexibility with some target movements will help improve your toe touch and reduce your risk of injury. Squat is burn calories and might help you lose weight. Squats improve your flexibility too. As you become older, your tendons, muscles, and ligaments become less elastic. Squatting helps shape up your legs and butt since it targets the glut and inner thigh muscles. Jumping jacks are a type of total body exercise that you can do anywhere with no equipment. As you jump, you are working against gravity and using your body weight for resistance, which can improve strength. Stretching your body is a very important factor in the procedure of cooling down. After exercise, your blood is heavy in your extremities and your heart rate is usually elevated. The purpose of the cool down is to return your heart rate close to resting. Stopping quickly without a cool down can result in lightheadedness, dizziness, or fainting. So, why do we need to do the cool down exercise? Cooling down allows your body temperature, blood pressure, and heart rate to return to their normal levels. Stretching your muscles while they are still warm can help to reduce lactic acid buildup, reducing your chance of muscle cramps and stiffness. Benefits of yoga is to improve strength, balance, and flexibility and helps with back pain relief.